Doctor, can we talk about cancer a little bit? Various types out there. What are some of the things that you've seen in terms of your patients, and what some of the things that you've been able to do?
There was a study that was published, I believe it was in 1994. It was a 12-year program, 12-year study. They looked at adults who had developed cancer as an adult, not childhood cancer, but adult cancer, right? And this is the main types of cancer that we get here in the United States. They did a meta-analysis of these people all around the world who developed cancer as adults for 12 years and were treated with chemo. And they looked at the results. And they published the results in the Journal of Clinical Oncology. And the results? 97% of the time, chemotherapy does not work. 97% of the time, it doesn't work. So why is it still used? It's one reason, and one reason only: money. If you go to a medical doctor, an MD, with a sinus infection, and that doctor prescribes an antibiotic, he gets no financial kickback. Now, if he prescribes 5,000, of that antibiotic in 1 month, the drug company that makes it might send him to Cancun for a conference, right? Mm-hmm. But he gets no direct remuneration. It's not with chemotherapeutic drugs. It's different. Chemotherapeutic drugs are the only classification of drugs that the prescribing doctor gets a direct cut of. So if your doctor prescribes chemotherapy for you, here's how it goes, more or less. The doctor buys it from the pharmaceutical company for $5,000, sells it to the patient for $12,000, insurance pays $9,000, and the doctor pockets the $4,000 difference. The only reason chemotherapy is used is because doctors make money from it. Period. It doesn't work 97% of the time. If Ford Motor Company made an automobile that exploded 97% of the time, would they still be in business? No. This is the tip of the iceberg of the control that the pharmaceutical industry has on us. Most people have no idea of this at all. Now,